Hello everyone, welcome to my channel. I am Dr. Sudhakar, a general pediatrician. Most of the babies delivered in hospital will undergo blood tests before getting discharged. So one among the screening tests is testing for jaundice. So in this video, we will be seeing why jaundice occurs in a newborn, and if it occurs, do parents need to worry? What are all the problems that you can expect in a child with jaundice and how it is treated? Before going into the video, if you have not subscribed to the channel, please subscribe. Let's get into the video. Our body is made up of lot of cells and each cell has its own lifespan. So after this lifespan is over, the old cells will be replaced by new ones. Similarly, in our blood, there are red blood cells and the lifespan of these cells is around 3 months. After this period, the old cells will be destroyed in an organ called spleen, and it will be replaced by new red blood cells. As a consequence of this destruction, there will be release of several byproducts, and the most important one is bilirubin. Normally, this bilirubin will be eliminated from our body with the help of liver, but in a newborn, the liver is not completely matured at birth and it will take few days for it to attain its maximal functional capacity. So till then, there will be gradual accumulation of this bilirubin in the baby's body, which you see as the yellow discoloration of your baby's skin and the white part of the eye. So, is this jaundice abnormal? No. The so-called neonatal jaundice is usually very benign and most of the newborns will be having this jaundice. Rarely it can become problematic in few babies where the destruction of their red blood cells will be very high, ultimately resulting in rapid increase in bilirubin level, that is jaundice, in their body, and these babies might end up in problem. It is possible to have an approximate assessment of the jaundice by looking at your baby's skin color, but in order to know the exact value, we need to do blood investigations, or few hospitals may use a device called transcutaneous bilirubinometer, which can give the bilirubin value even without a blood test. Next, what could be the consequence if a baby gets jaundice? Like I already said, most of the babies will be having some amount of jaundice which is normal, but if it becomes very high, then the jaundice or bilirubin can affect the baby's growing brain, which ultimately results in significant morbidity and developmental problems, and the damage is irreversible. This is the reason that all the babies born in hospital are being screened for jaundice and then getting discharged. Okay. So if a baby gets high jaundice, then what are the treatment options available? Researchers have found out that if a baby with jaundice is exposed to blue color light, then the bilirubin level rapidly comes down, and hence a baby with jaundice will be exposed to artificially created blue color light, and this blue color light destroys the bilirubin present over the skin by several reactions. This method of treatment is called phototherapy. Very rarely, a baby can have very high bilirubin, and this phototherapy may not be sufficient to treat the baby. In that case, the baby's whole blood must be exchanged with a new blood so as to remove all the bilirubin immediately. This is called exchange transfusion, and it's very rare for a baby to require exchange transfusion. So here are a few important things which a parent must know. After birth, by around 3rd or 4th day, the baby's eyes will become yellow in color. This happens even with very low level of bilirubin, and it will take 3 to 4 weeks for this yellow color to disappear. This is one of the most common complaints which we get during the 2nd week follow-up of a baby, and it is completely normal. Second, a baby will be having yellow discoloration of skin, but if this yellow discoloration extends to palms and soles, then it means that baby is having relatively high bilirubin. You need to consult your doctor immediately. Third, there are a lot of controversies whether you can use sunlight as a mode of treatment of jaundice. One thing is clear, sunlight cannot be used to treat a baby with very high jaundice because it is only the blue part of the sunlight which helps to decrease the bilirubin. So a complete blue light like phototherapy will be better than sunlight. For mild type of jaundice, this can be tried, but do consult with your pediatrician before doing so. Next, the jaundice which we discussed till now is called as indirect jaundice or physiological jaundice, which is harmless and it occurs only in newborn and it disappears within 1 or 2 weeks. Apart from this, there are few problematic jaundice called as direct jaundice, which needs a totally different type of treatment. Basically, in a baby with physiological or indirect jaundice, the baby's urine color will be normal and the stool color will be yellow. But in a baby with direct jaundice, the urine will be dark yellow in color and the stools will be clay colored or pale color. Like I said, if you notice this pattern in your baby, immediately consult with your pediatrician. These are the basic information which parents must know regarding baby's jaundice. I hope I have covered most of the informations. If I missed anything or if you have any doubts, you can ask it in the comment section. I will reply as soon as possible. I hope this video was useful to you. If you want similar contents, subscribe to the channel, and if you find the video useful, share to your friends and relatives. I will meet you with another interesting video. Until then, bye, take care.